14 hospital trusts will have their family and neonatal services reviewed as part of an independent national investigation. It was announced, you might remember, back in June as a response to 15 years of problems, with research suggesting that harm to and the deaths of hundreds of babies could have been prevented with better maternity care. Some of the families whose cases will be part of it, though, have expressed concerns about the way that the review have been put together. They are the Maternity Safety Alliance. Emily Barley is the co-founder, and her baby Beatrice died at Barnsley Hospital because staff mistakenly checked Emily's heart rate rather than Beatrice's. The hospital has apologised since then, but Emily doesn't feel that this investigation is going to be good enough.
When the maternity investigation was announced by Wes Streeting in June, he said that it would tackle all kinds of things, and that included getting to the truth of what's happening, included giving us accountability and justice. But what we're finding now is that the investigation is not going to address really key issues. Regulators, for example, which are an enormous part of this problem, are to be completely excluded from the investigation, which means it's not going to have a full picture of what's going on. And Baroness Amos has told families that it will not deliver justice. So we feel really, really let down. What we're asking for is for the investigation in this format to be scrapped and for us to have a statutory public inquiry, which is the only way for us to get into all of the issues in all of their detail and complexity.
Well, Baroness Amos, the chair of the Maternity and Neonatal Investigation, joins us on the programme. Good morning, welcome.
Good morning, thank you.
I'd like to invite you, first of all, to respond to what Emily Barley had to say there, as I'm sure you would. Her concerns about the investigation.
Well, thank you. The Secretary of State has asked me to do a very rapid investigation with initial findings by December. There have been a number of other reviews in the past, and one of the key things is to look at the recommendations from those reviews, think through what has changed, what hasn't changed, and what more needs to be done. Coming specifically to Emily's comments, and I have had the opportunity to speak to a number of groups of families. I'm extremely grateful to them for talking to me, because I know that retelling their experiences is extraordinarily difficult, and they shouldn't have to do it. Families, understandably, are frustrated, they're angry, they're traumatised. They're having to be resilient when they shouldn't be. So the terms of reference of this review, I think, are extremely extensive given the time in which we have to do a rapid review. Unfortunately, I cannot do individual case reviews of the many cases that families have brought to my attention. I know that a lot of families would prefer a public inquiry. That decision does not rest with me. On the point, made two other points, please, that Emily raised. One was in relation to the regulatory bodies. Again, within the terms of reference, it does include regulatory bodies. But again, what I was explaining to the families is that an extensive, in-depth, comprehensive review of the regulatory bodies is not something that I can undertake within the current review. Regulatory bodies are not excluded, but the kind of in-depth review that is being requested is not something that I am able to conduct. And on the point about truth and justice, this is something that families are desperately looking for. They have not been listened to. What I hope that we will be able to do is to make recommendations which put in place the systems and structures that enable those families to get that justice and accountability.
It was interesting to hear her use that line, which you just touched on there, you telling the families that this will not deliver justice, because As you say quite rightly, a set of recommendations to improve future maternity care is so important. But for those bereaved parents who know that their children are not with them for reasons that didn't need to happen, reasons out of their control, justice is such an important part of this. Can it be a proper investigation if it doesn't deliver justice?
Anna, there have been so many investigations and reviews before this. There is a major investigation going on now in Nottingham, looking at a range of issues, but including looking at the cases of a number of families. Obviously, I will liaise with that investigation, although it is not expected to report until June. I want to make sure that the systems and processes are in place that enable the families to get the justice that they want and that they deserve. What we have now is completely unacceptable. How we have got to a situation where so many trusts have been investigated, where we have hundreds of recommendations, and yet still the Secretary of State has had to ask me to look again so that we pull together a set of national recommendations, which he, with a task force that he is putting in place, that will have experts and families and campaigners on it, that they can then ensure that those recommendations are implemented.
Baroness Amos,
That's where we are now.
Time is against us, but there is one final thing I wanted to ask you, which is that today the Chief Executive of the General Medical Council will tell a conference that, in his words, something must have gone badly wrong because trainee obstetric and gynaecology doctors are fearful of speaking up. More than a quarter, says the GMC, are hesitant, escalating a concern to somebody at a higher level. This is a really key part of what you will be looking at, presumably.
Absolutely. If those who are working in the health service do not feel that they can bring issues to the attention of those who are in positions of authority and responsibility, we have a major problem to address. And I hope that the recommendations from this review will assist with that.
Baroness Amos, thank you very much indeed for joining us.